Hi, my name is Monica Bardwell, and I'm a student at the University of South Florida, and today I'm going to be doing a physical exam. Alicia, is it okay if I do a head-to-toe assessment on you?
Yes.
Alright, and before Alicia entered the examination room, her height and weight and her vital signs were obtained, and her distance vision was assessed via the Snellen chart. We're going to begin this assessment by looking at Alicia's overall general appearance, just watching her walk in, making sure she didn't have any physical deformities, just looking and seeing if she's dressed appropriately for this examination, and looking at her mood, if she's pleasant, which she is. I'm going to be looking at your skin and just looking for the texture and palpating, feeling for the temperature, which she's normal. I'm going to be looking at her nails and her fingers, making sure there's no cyanosis and her capillary refill is immediate. And I'm going to be doing this all the way down both legs and both arms, looking for any edema and just making sure that her skin is nice and warm and her capillary refills are nice in her toes as well. Next, I'm just going to look at her overall head and her face. I'm going to be just looking at her symmetry, making sure that her eyes are even with her ears and her hair is evenly distributed. I'm going to be palpating her scalp and making sure that there's no lesions or masses. All right, Alicia. And I don't feel anything, and it's good just to look behind because sometimes there can be lesions back there that can get easily missed. All right. Alicia, I'm just going to get you to do a few facial movements for me, and I'm going to test your cranial nerve number 5, which is the trigeminal. So I'm going to get you to just do a big smile for me and a frown. And open your eyes really big and close them really tight. Good. And that was actually cranial nerve number 7. And number 5 is going to be your motor and sensor. And I want you to open your mouth and close it. Good. And I'm just assessing her T and J joint, just listening for any clicks, making sure that it's freely movable. And also on cranial nerve number 5, it's a sensation cranial nerve. So I would have a cotton swab. Sorry. And I just want you to close your eyes, and I want you to tell me where my cotton ball is swiping across.
Forehead, cheek, chin.
Good. All right, and that is our number 5, our cranial. And then I'm going to move my assessment and palpate your temporals and your masseter. All right, and I'm going to palpate your sinuses, your frontal sinuses, and I want you to tell me if there's any pain or tenderness.
No.
And her maxillary sinuses. Okay, good. Next, I'm going to look at her eyelids and her eyelashes and make sure that they're still symmetrical and even the hair is evenly distributed. I'm going to look at her sclera and her conjunctiva, making sure there's no redness or drainage in both eyes. All right. And also on the eyes, I'm going to check for cranial nerve number 2, which is the optic nerve. And we're going to do this by doing what's called a confrontation test. Alicia, I want you to tell me whenever you can see my fingers come into your peripheral vision.
Now. Now. Now.
Good. All right. So via the Snellen chart and the confrontation test, she has an intact cranial nerve number 2. And number 3 is the ocular motor. And we're just going to be looking at the pupils and checking the shape and size and making sure that she is round and reactive to light and that her eyes are nice to accommodation. Just follow my fingers. Good. And you're just going to watch for pupil constriction. Next, I'm going to take my pen light and I want you to just look straight, focus your eyes on one spot on the wall. And I'm going to make sure that her eyes are constricting to the light. Good. And now I'm going to check for consensual constriction, which is whenever I shine it on her right eye, her left eye constricts. And when I shine it on her left eye, her right eye is constricting, which is consensual constriction. And that would be our ocular motor number 3. Next, we're going to check your 6 cardinal movements of gaze in your eyes, which is the extraocular movements. So I want you to just follow my fingers again. To the medial, upward, downward, back to the middle, up and down. And upward would be the trochlear nerve, which is number 4. And number 6 would be the abducens, which would be the lateral aspects of her extraocular movements. We would also take an ophthalmoscope and look at the internal structures of her eye, looking at the optic nerve and the optic disc. But we'll do that for another exam. Next, we're going to just look at your ears, noting the symmetry. If it's midline, even with the eyes, the top of the earlids should be just even with the eyes. And I'm just going to be looking for any drainage. I'm going to palpate the auricle. Alesha, I want you to take your finger and put it up to your tragus and tap really fast. And I want you to repeat a word that I'm going to say. Apple. Good. And that's what's called the whisper test, and that would be assessing cranial nerve number 8, which is the acoustic nerve, which was intact. All right, and next we're going to go to the nose. We would also, on our ears, assess with the otoscope. We would assess the tympanic membrane, making sure that it's white and pearly. We don't want to see any redness or inflammation or any drainage. And cranial nerve number 1 would be assessed by the nose by doing olfactory. You can take your finger and put it over one side of your nostril, blow out. All right, and do it to the other. Good, and we're just checking for patency. And the olfactory nerve is not really done in the clinical setting, but we could take a cinnamon or lavender or some kind of smell and just assess your smell and make sure that your smell is intact. Next, I'm just going to look at your mouth, looking at the color, making sure there's no cyanosis, and I'm going to palpate inside your buccal mucosa. All right. Just going to be making sure that there's no inflammation, making sure there's no lesions, just looking for the cleanliness. Good, and lift your tongue up for me. Good, and there's no lesions, because sometimes lesions can hide under the tongue. And now stick your tongue out for me, and to the right, and to the left. Good, and her uvula is midline. This would also be a sign of an intact cranial nerve number 12, which is the hypoglossal. And also we can assess cranial nerve number 9 and 10 with her mouth open, and this would be done with a gag reflex. I would have a tongue depressor, and I would put it on her tongue, and I would touch the uvula, seeing if she had a gag. So cranial nerve number 9 and 10 would be intact, which is the glossopharyngeal and the vagus. The vagus nerve also does the diaphragm, so we would just be making sure that her diaphragm is moving up and down evenly. Okay, next we're going to look at Alesha's neck, making sure that there's no lesions, making sure that her neck is midline even, and I don't see any twisting of the neck. And I'm just going to palpate. I'm going to palpate your lymph nodes and check your preauricle, your postauricle, your occipital. I want you to tell me if there's any pain or tenderness.
No.
Jugulo-digastric. Look down for me. Submandibular and submental. The superficial cervical, and just turn slightly to the right. We would assess the deep cervical chain, which is best done with their head turned slightly diagonal. All right, look back straight. And we're going to do the superficial, this supramandibular clavicular. All right, and I don't feel any hard nodules or any freely movable nodes. Next, I'm going to look for jugular JVD, which is her jugular venous distension. If I can get you to take a look to the right corner, the left corner of the room. And we're just looking, making sure there's no distension and any pulsations. And we want to note that there's not any heaves or thrills on the carotid artery. And this is actually best assessed when the patient is supine and in a 30-degree elevation. I'm just going to palpate for any thrills or heaves. And we want to make sure whenever we're assessing our carotid artery that we're not doing them at the same time, because it could occlude blood flow up to the brain. Okay. Look straight for me. Good. And a brew would just be a turbulent sound of blood flow. Next, we're going to be looking at her trachea, making sure that it is midline. I'm going to palpate her trachea. And then I'm going to attempt to palpate the thyroid gland, which is behind the trachea. I'm going to move it slightly to the right and to the left. And I can't palpate any thyroid gland, which is a normal finding. I'm going to move my assessment now to the lungs. We're just going to be looking at her respirations, making sure that her depth, her rate, and just her effort, making sure there's no accessory use of any other muscles, and she appears to be in no respiratory distress and no short of breath. All right, next I'm just going to, actually, Alesha, do you mind taking your shirt off, please? Good. All right, I'm just going to palpate. Good. All right, I'm going to percuss both sides. And a normal sound over the lungs would be a resonant sound. If we hear any dullness, that would indicate that we're over a rib cage, like bony prominences. Next, we're gonna look at the carina, which is in the fourth intercostal space on the right side, which would be right about here. And we're gonna note that the right lobe, the carina, and the apices of the lungs start about right underneath the clavicula, both underneath the clavicles. And I'm going to do that. That was the anterior portion of the lung exam. Now I'm going to ask you to turn over and we'll do the posterior side. And while you're this way, I'm just going to auscultate for any adventitious sounds on the front too. Good. Deep breath. Couple more. Alright. Good. Alright. And now we're going to do the same thing on her back. We're just going to be looking at the overall configuration of the chest, looking at the anterior posterior diameter, making sure that it's not, the ratio is not bigger. We want to note about a 1-to-1 ratio. Anything bigger might indicate a COPD. Alesha, I'm just going to palpate back here. I'm just going to be noting any masses. Tell me if there's any tenderness. All right, and next I'm going to assess for tactile fremitus. I want you to get you just to say 99 each time I move my hands.
99, 99, 99, 99, 99.
Good.
99.
And we're just listening for any vibrations in our hands. We're going to test the diaphragmatic excursion and get you to take a deep breath. And out, and one more time. Good, and our thumb should come out about 5 centimeters, which is about normal for the diaphragmatic excursion. We can also percuss, and we want to note that anytime we don't hear resonance anymore, and the minute we hear dullness, we want to note that, and there should be about a 5 centimeter difference whenever we're measuring the percussion on the back. We want to hear a nice resonant sound. Good. And then I'm just going to auscultate for any adventitious lung sounds. Take a deep breath. Good. All right, we're going to do the same thing all the way down the back side of her lungs. And then we're going to listen on her lateral aspects of her lungs as well. Good. Deep breath. Very good. All right, and you can turn back to the front. Whenever we're assessing the lungs, we can also take note of her fingernails and make sure that she doesn't have any clubbing, which can indicate cyanosis. You can put your shirt back on. Next, we're going to do the cardiac assessment, and we're just going to be looking for the PMI. We're going to make sure that it's at the 5th intercostal space and we can feel it nice and strong. Good, and if we felt it anywhere else, like about the xiphoid process or the epigastric area, we might indicate that the patient has left ventricular hypertrophy. I'm going to palpate your pulses. I'm going to check your brachial, which is right by the right deep in the humerus, and your radial, which is the thumb side of your hand, your ulnar, and we would do this to both sides. And while we're assessing the cardiac system, we also want to note any edema, and this is the dorsalis pedis and the posterior tibialis, and they're nice and strong and regular. Okay, you can put your foot down. All right, and whenever we're doing our cardiac assessment, we want to listen with the bell of our stethoscope as well as the diaphragm. Just sit right here. We would also do this with Alesha in a laying down position on her left side. And we would do the same thing with the bell of the stethoscope as well as the diaphragm. And your lungs sounded okay. Next, we're going to move to your abdominal assessment. Actually, I'm going to get you to take your, actually, we'll just lift your shirt up. All right. And on Alesha's abdominal assessment, we're just going to be looking at the overall shape and contour of her abdomen. It's nice and flat, and it's